The femur snaps with a sound like a wet branch breaking, and the leg folds at an angle that God never intended. You are 20 miles from the nearest road, the grid is silent, and the ambulance is a fairy tale. The victim is screaming. You have no splint, no traction device, no morphine. You have a nylon tent pole, the laces from your boots, and a decision to make. You can let them die from shock and a fat embolism on the forest floor. Or you can turn those two useless objects into a traction splint that pulls the bone straight, restores the blood flow, and gets them out of the woods alive. Most people will freeze and weep. You are going to build a hospital out of camping trash. Subscribe so you never miss this. Stay for step 5. The one most people skip because it looks cruel, but skipping it is what turns a salvageable leg into an amputation or a survivor into a corpse. The systemic lie is that you need a SAM splint, a vacuum mattress, or a paramedic with a morphine drip. The prepper industry sells shiny traction devices for $200. The reality is that a femur fracture has been treated for centuries with a stick and a strip of cloth. The physics doesn't care about branding. A broken femur is a spasm of raw muscle. The quadriceps and hamstrings contract violently, yanking the shattered ends of bone past each other like two feral animals fighting. The only way to stop the pain and save the leg is to pull them apart and hold them in line. A tent pole gives you the lever. The shoelaces give you the bindings. The technique is called traction splinting. It works in the dark, in the mud, and with hands that haven't slept. Step 1. Manage the shock, not just the leg. The person on the ground is dying from more than a broken bone. A snapped femur can bleed a liter of blood into the thigh compartment before you ever see a drop. The pain is so immense it triggers a vagal response that tanks the heart rate and drops blood pressure. Before you touch the leg, you lay them flat on their back on a sleeping pad, a pile of leaves, anything to insulate them from the cold ground. You cover them with a blanket or a jacket. You speak in low, steady tones. I am going to fix this. It is going to hurt, and then it is going to stop. You explain what you're about to do. The brain in terror needs a script. Give it one. Most people attack the injury, while the victim spirals into hypovolemic shock on a frozen rock. The leg is broken. The whole body is crashing. Treat the entire patient. The tent pole and laces are useless if the heart stops before you finish. Step 2. Cut the clothes and assess the realignment. Do not try to roll up a pant leg over a deformed femur. You will move the bone and cause more internal damage. Take a knife or scissors. Cut the seam of the pants from the ankle all the way to the hip. Expose the entire leg. Now look at the foot. If the foot is pale, cold, or turning blue, the femoral artery is compressed or severed. You have minutes, not hours, to restore blood flow. Check for a pulse on the top of the foot. Now, straighten the leg. This is the part that feels cruel. You grip the ankle firmly with one hand below the fracture and the other above the knee. You pull in a straight, steady, firm traction along the line of the bone. Do not yank, do not jerk. A smooth, constant pull that overcomes the muscle spasm. The victim will scream. The screaming stops when the bone ends separate and the sharp edges stop grinding. He will see the leg slowly lengthen and the deformity begin to resolve. The blood returns to the foot. The screaming turns to rhythmic breathing. Hold that traction and do not let go. Most people are afraid to hurt the victim. Your fear of causing pain will kill them. The real cruelty is leaving the bone ends grating against the femoral artery while you hesitate. Pull firmly. Hold it. You are the traction now. Step 3. Build the traction splint with the tent pole. You are still holding traction with one hand. Your other hand and a helper now grab the tent pole. A modern nylon tent pole is too flexible to use whole. You snap a section out, the longest straight piece you can get, or you bundle two sections together with tape or cloth to make a rigid strut. If it's a fiberglass pole, tape it heavily to prevent it from splintering into your hands. This pole will run from the armpit to well past the foot. It needs to be longer than the leg. If you have no tent pole, a straight branch, a trekking pole, a rifle stock, anything rigid works. Place the pole alongside the injured leg on the outer side. Pad the top of the pole where it will press into the armpit. A rolled shirt, a folded towel, a wadded jacket. The padding prevents nerve damage under the arm. Then pad the crotch, the knee, and the ankle. The entire length of the pole against the body must be separated from skin by cloth. Most people tie a stick directly to skin and create pressure sores and nerve compression within hours. Pad it. The pole is not a torture device. It's a skeleton. Step 4. Secure the pole with the shoelaces. Untie your laces. They are flat, strong nylon or polyester cord. If you have paracord, use it. If you have long strips of torn clothing, use those. The laces are your cravats. You will tie them in 5 places. One around the ankle, one around the shin just below the knee, one around the lower thigh above the fracture site, one around the upper thigh, one around the pelvis or waist to anchor the top of the pole. Each knot is a reef knot, square, flat, and tight. Right over left, left over right. Do not cinch down on bare skin. Every tie wraps over the padding you placed. Now, for the traction mechanism. Take a shoelace and create a loop around the ankle. Tie it. Run that lace down to the end of the tent pole that extends past the foot. Pull the lace tight like a guitar string, then wrap it around the pole tip and tie it off hard. This ankle tie is pulling the foot toward the far end of the pole. It maintains the constant traction you were holding with your hands. The pole takes over. The leg is now stretched straight, the bone ends separated, the artery decompressed. Most people skip the ankle traction tie and just strap the leg to a stick. That is a simple splint. It does nothing to overcome the muscle spasm. The traction tie is the entire point. Without it, the leg heals short, crooked, or never heals at all. Step 5. Reassess the distal pulse. You have the splint built. The traction is on. Now you check the foot again. Look at the color. Pink is good, pale is bad, blue is a catastrophe. Press a fingernail into the top of the foot. It should blanch white and then refill pink in under 2 seconds. If it does not refill, the traction is insufficient or the artery is torn beyond your ability. Adjust the ankle tie. Tighten it slightly and recheck. Once circulation is confirmed, secure the leg further with additional strips of cloth above and below the fracture to prevent rotation. Tell the victim to wiggle their toes if they can. Document the time the splint was applied by writing it on their forehead with a pen. If you have no pen, scratch it into a piece of bark and tie it to their wrist. A hospital, if one still exists, needs to know how long the leg has been under traction. Most people finish the splint, sigh with relief, and forget to recheck the pulse. A silent clot or a slipping strap will kill the leg while you high-five each other for a job well done. The job is not done until you confirm life is still flowing to the toes. Here is the reality. The medical supply catalogs will never print. A human leg is a meat puppet, powered by spasming muscles. When the bone snaps, the muscles win. The only thing that beats them back is steady, sustained traction and a rigid lever. The tent pole is a lever. The shoelaces are your tension cables. The hands that pull are the engine. You do not need a $200 traction splint. You need the physics of a pole, the material of your own gear, and the mental discipline to cause a moment of necessary agony for a lifetime of walking. The victim will remember the pain of the pole. They will also remember the face of the person who did not flinch. Now drop a comment and tell me this. How long is your current shelter setup pole or trekking pole, and could it serve as a femur splint if you had to pad it right now? Go measure it. Write the length in the comments. Then go find an old tent pole in your garage and practice the lashings on a rolled up sleeping bag until the knots are muscle memory. And in the next video, we are moving from the leg to the shoulder. How to reset a dislocated shoulder with no partner, using a doorway and a 3-foot loop of webbing. I'll see you there.